Hi, welcome to Let's Talk About Tobacco. We're going to be talking about different things that affect the public and our students today. We're going to be talking about health risks, the social impact, and some of the marketing they do that's directed directly at our students. And I'm here today with three of my favorite experts. We have Janiece Davis from the Department of Health. We have Dr. Barry Hummel from QuitDoc. And we have Dr. Michael Feinstein from the American Lung Association. Welcome to the show.
Thank you.
Thank you.
As I said, you guys are my three favorite experts, and it's nice because we're relatively local here. So starting risk is probably the big thing that we've heard for as long as I can remember, and that's secondhand smoke. What are some of the risks involved in secondhand smoke? If I'm not a smoker and I'm around a smoker?
Well, I think probably, Mike, we should define what secondhand smoke is in order to lead into that discussion. I don't think most people realize that the majority of the smoke that actually comes off of a tobacco product is not inhaled by the smoker. And that's an incredibly dangerous, toxic milieu because it's unfiltered. And as Mike will attest, the primary filter is actually the lungs of the person smoking it. So what you're dealing with is at least 4,000 to 7,000 chemicals that come off that burning product. In excess of 60 of them are known to cause cancer. And so when somebody does this in a public place, that's actually being shared among everybody in that space. Wow. And that's why it's an increased risk to everybody involved.
Also, the proximity and the environment in which the secondhand smoke is being inhaled is a factor as well. For instance, if a parent is driving their child to school in the morning and smoking a few cigarettes on the way to school, it's a very confined environment, and that child is really getting a very heavy dose.
That makes a lot of sense, yeah.
There's an estimate that if you're in a car, for example, if somebody smokes a single cigarette, that everybody in the car has actually had the privilege of smoking 3 cigarettes. Wow. Because of the recycling of the air in the car and because most of the toxins are in the unsmoked part to begin with. So even the non-smoker has had the joy of smoking 3 cigarettes in that environment. So it's an incredibly important issue.
Serious health risk even if you're not smoking, but if you're around smokers.
Absolutely. And
now, I've heard that term side smoke, and that referring
well,
to
side stream smoke is the smoke that comes off the end of the product. So anything that's not inhaled by the smoker is defined as side stream smoke, and then mainstream smoke would be the smoke that's inhaled and exhaled by the smoker.
There's also another concept, if I may. The American Academy of Pediatrics published a very decisive article in 2009 in their journal talking about third-hand smoke. And I know I've gotten calls in the office on occasion from parents who tell me, I really would like to quit. I just gave birth to my baby, and I'm very motivated. I really would like to stop now. And I said, give me a little scenario. How does it work in your household? And the mother said, well, the baby's in this nursery in the crib, and I will never smoke around my baby. So I go in the living room and I smoke, and after I smoke, I put out the cigarette, and then I feel safe going back to the baby. And what do? Well, I pick up the baby, I burp the baby, I hold the baby, and the baby is actually getting the fallout of the secondhand smoke because mom's in the living room and all that secondhand smoke is landing on her hair, her skin, her clothes, on the carpet, on the upholstery. And that baby, it's been estimated, is getting 20 times the exposure to those harsh toxic chemicals.
20 times?
Yes, because of their metabolism and their size and the lung function. So that's a major issue as well, and not many people are even aware because it's a relatively recent finding and report by the American Academy of Pediatrics.
And I think it's also important to mention that there are very serious health consequences from secondhand smoke exposure, such as SIDS, sudden infant death syndrome, middle ear infection among children, asthma attacks as well. So there are actual health outcomes, and it has been shown to affect academic performance. So children who are exposed to secondhand smoke at home tend to perform lower on tests than children who are not exposed to secondhand smoke at home. So there are actual health and academic performance indicators as well.
And those risks are at every age group. So in other words, a 5-year-old who lives in the home of a smoker has significantly more illnesses, more frequently, more severe than a 5-year-old who lives in the home of a non-smoker. You take 7-year-olds and compare it, it's the exact same thing. And it's all the way through adolescence. The younger they are, the more severe and more significant those problems are. But there's a disparity at every age group along the way. Asthma being a particular problem where any number of chemicals can set off an asthma attack. So now you put them in an environment where there's somewhere between 4,000 and 7,000 different ones, and that's going to set off asthma attacks with much more significant frequency severity. They end up in the hospital more. They end up in the intensive care unit more. So it's an enormous problem.
It's actually been estimated that if a child, a newborn, is in the environment of secondhand smoke from parents or other people in the house smoking, that the incidence is double the normal incidence of a child who might not be around smokers at an early age.
So people in our generation, we would possibly recognize more impact from our parents who, we had more smokers when we were growing up.
Absolutely.
But this generation, do we see any decreases?
Decreases in?
Decreasing in, well, the adverse effects, like asthma, for example. Are we seeing a decrease in asthma because we have fewer people smoking?
Actually, asthma is increasing because there are other factors involved with asthma besides smoking. There may be some genetic factors, environmental factors, allergic factors.
So there's no way to get that
yeah,
yeah, it's hard to quantify.
Tobacco is just one of the factors with asthma specifically.
But that's one we see reducing a little bit?
I think the thing we've seen over time, if you look at statistics from the Florida Youth Tobacco Survey, for example, is there's a decrease in the exposure to secondhand smoke. You know, it was roughly 80% of high school students back in 2000 said they were exposed to secondhand smoke, and now it's closer to about 55, 58%. So we've seen a significant decline in the state of Florida over the last 10 years. But think about that number, because even now, let's say it is 58% of high school students, which it is in Martin County,
Still
where I work. There's only, in Martin County, we have 17% of the adults who smoke, and 58% of the high school students say they're exposed to secondhand smoke. So every smoker is affecting 3 people in their environment. And when you couple that with the fact that we know that roughly 10% of smoking-related deaths occur in non-smokers exposed to secondhand smoke, it's a significant health risk. Now, the good thing about kids is most of them grow up to be 18 and then leave. Less now than 10 years ago when the job situation was better, but they leave the house. And once they leave the house, because I get asked by kids all the time, am I at risk if I live with my parents who smoke? And I kind of share with them that no, because you'll leave eventually and those risks will kind of drop. We see that a lot in spouses who've lived together for a very long time, or other caretakers and grandparents in the home and that sort of thing, but not really with kids who lived in that environment through 18 and then left. They don't have any increased risk of bad diseases like cancer or heart disease or those kinds of things down the road.
Okay. I see all the statistics about how if a smoker quits smoking, they can recover a lot of their health over a period of time. Is the same true for secondhand smoke?
Yes.
Reducing your exposure?
Oh, yeah, sure.
Absolutely. And remember, the exposure risk is cumulative over time. So the sooner you're out of the environment, the quicker you're going to return to normal things. Those statistics on how quickly you recover after you quit smoking are very interesting, actually. If you look at the short ones, there's a lot of real quick short-term gains, a return of blood pressure to normal.
Yes.
You know, there's a lot of people who smoke who are on blood pressure medication, and they simply would quit smoking. They could probably come off some of that medication. But the things that are really interesting down the road is somewhere at about the 5-year mark after you quit, your risk of a heart attack is the same as a member of the general population who never smoked. Cancer is a little harder to quantify depending on your exposure, but roughly 10 years out after you quit, your risk of cancer, lung cancer in particular, is the same as that of somebody from the general population who've never smoked. So quitting is incredibly important because you get instant health gains and you get health gains for a decade to come.
Yeah, you talk about risks associated with tobacco, and you realize we've been talking for several minutes here, and this is the first you've mentioned cancer, which is what most people associate it with. So when we come back in a minute, we're going to be talking more about the risks of using different forms of tobacco and how it may affect you.